Welcome to Pharmacology Mini number 3, where we'll talk about drug classification. To start off, the drug names. There's different ways that we can name and identify medications. The chemical name is based on the drug's chemical structure. The generic name is the active ingredient of the drug produced, and the trade or brand name is a name given to the medication by the manufacturer. So for example, for Motrin, the chemical name would be RS-2,4,2-methylpropyl-phenylpropanic acid. The generic name would be ibuprofen, where the trade or brand name could be Motrin, Advil, Brufen, or Nurofen, depending on who has created or manufactured that particular medication. You do need to know both generic and brand name for the NCLEX. One way that we can classify medications is through their drug schedule, and this is typically for drugs that are risk for being addictive. So a Schedule 1 or a Class 1 medication has no accepted medical use and is highly abused. Examples of this would be street drugs like cocaine and heroin. A Schedule 2 is medications that are addictive and abuse drugs, but do have some medical use, like opioids and stimulants. Schedule 3 has moderate to low potential for physical or psychological dependence, and examples of this would be things like Tylenol with codeine. Schedule 4 would be low potential for abuse or dependence, and this includes some benzodiazepines and sleep medications. And then Schedule 5 has very low potential for abuse, and examples for this would be like antidiarrheal or antitussive medications. Certain providers do need to have a special license to prescribe some of the higher drug schedule medications. And then we have our drug categories. So common drug categories that we will talk about throughout our pharmacology minis are things like analgesics, which are pain medications, antacids, which produce gastric reflux, anti-anxiety medications, which help reduce anxiety, antiarrhythmics, which help to create a more stable heart rhythm, antibacterial, fight bacteria, anticoagulant or thrombolytic, prevent clots, anticonvulsants, prevent seizures, antidepressants help treat depression, antidiarrheal medications help to treat diarrhea, antibiotics help with nausea and vomiting, antifungals fight fungus, antihistamines will be used for allergic reactions. Antihypertensives are used for hypertension and high blood pressure. Anti-inflammatory help reduce inflammation in the body. Anti-neoplastic help prevent the growth of new cells, and so it's used in chemotherapy and in cancer. Antipsychotics are used for psychotic episodes. Antipyretics are used for fever. Antivirals fight viruses. Barbiturates can be used for pain. Beta blockers help to reduce heart rate. Bronchodilators open up the bronchioles so that you can breathe better. Corticosteroids are steroids that are used to reduce inflammation, and they can also be used sometimes for impacting blood sugars. Cough suppressants are decongestants, relieve congestion, and expectorants help to bring up any congestion that you may have. Diuretics is to diurese the body. Hormones can be used for a lot of different things, especially things like menopause. Hypoglycemics are medications that are used for blood sugar control. Immunosuppressives are used for autoimmune disorders. Laxatives can be used for constipation. Muscle relaxants are used for pain and muscle spasms. Hypnotics or tranquilizers are used for sedation. And then our vitamins. And that is the common drug categories.